Platelet-rich plasma is what we're doing is we're taking the patient's own plasma and we're concentrating it down. So we take 5 to 10 cc's of blood and place it in a special tube and then put it in a centrifuge and spun down over a few minutes time, and it's separated into the yellow plasma above and the red cells down beneath, and then there's this little white layer that sits right on the top of the red, and that's where all the white blood cells sit, and right above that is where the platelets are concentrated. So we used to think of platelets as their main function just was for coagulation of the blood and creating clots and things like that, so that when you get cut, you don't bleed to death along the way. And what's been found is that inside those platelets, there is a lot of other things, and so they've discovered a lot of growth factors inside of the platelet, and those growth factors are there to assist in injury and healing. So God's natural process is you get injured, you bleed into the area, and those platelets are there to encourage things to heal. Well, we obviate that whole process because we're pushing ibuprofen and Tylenol and such at everybody, and we disrupt the whole thing. And so we disrupt what God has set for us in order to heal, because of the chemicals we put in our body. It makes you feel better, but it also makes the injury a worse injury. Anyway, the growth factors are like platelet-derived growth factor, transformational growth factor beta, insulin-derived growth factor, vascular endothelial growth factor, fibroblast growth factor, epidermal growth factor, interleukin-12, monocyte chemotactic protein, LX44, multiple cytokines and chemokines, and RANTES. All those little chemicals God put in those little packets in order to help heal the body. And what they do is when those are placed in a certain area, and after this blood is spun down and we separate out and pull out the platelet-rich plasma, we take and we inject that into the area. Well, how does that work? What happens is that there are little pericytes. We didn't know the function of pericytes for many years. They just observed that they were there, and the histology texts talked about them. What they are is those are little stem cell pockets that God placed in there, and they're all up and down all the blood vessels along the way. So if you tear open a blood vessel, you've got stem cells sitting right there to help start your repair process, and you get all the growth factors that are right there. Well, a lot of people have, like I mentioned, destroyed that process because they took a bunch of ibuprofen in order to help things to heal, and then things don't heal properly, and then you get a chronic injury that doesn't heal along the way. And so there's instability, and with the instability, there's more injury, and then there's more ibuprofen. There's a lot of prescription pad type stuff that destroys a lot of healing. And if you stop that whole thing, take the patient's own growth factors, so we're not taking something you can get contaminated from someone else, take the patient's own growth factors and inject those right into the area where the injury is, you can start that whole process of healing. So all we're trying to do.
How does that, but see, okay, I see where you're coming from, but